Now, the country's third largest private hospital operator, Netcare, has seen a steady improvement in both patient days and occupancy levels in its first half to end March. This despite a severe second COVID-19 wave. The pandemic affected hospitals countrywide as many patients deferred elective surgeries, but now the group says it's well on its way to recovery, posting a 375 million rand profit in its 2021 half year. The group saying also that it's in a better position to manage the consequences of a third COVID-19 wave more efficiently and effectively. Netcare played a role in the Sisonke J&J vaccine rollout to healthcare workers during that phase 1 stage. It's administered over 65,000 vaccines at its sites. Well, let's get now to the Netcare CEO, Richard Friedland. He joins us this afternoon. Richard, thanks very much indeed for your time. A couple of months ago, there was a sudden halting to elective surgeries. People stayed away from hospitals, and that partly led to the 196 million rand loss in the previous 6 months. What's changed in the last 6 months?
Well, what's changed is we've had a second wave, which has even been more severe than the first wave, but I think we were able to manage that better and contain the utilization of beds within our network. In fairness, when we were first confronted with COVID, no one had any idea what we'd be confronted with, and so literally we had 80% of our beds available to treat COVID patients. In the second wave, we only made 60% of our beds available, even though we treated 39% more patients. You know, we've seen 73,000 patients with COVID, and we've had to admit over 44% of them, of which 26% of those required high care or ICU treatment. And I think that just underscores how virulent this virus is and how concerned we should be about COVID-19. So in short, I think we managed it more efficiently, and we were able to still see normal activity through the period, even though we stopped elective surgery for 2 months.
And it's interesting you touch on that, you know, the number of beds and the bed demand during that second wave. I suppose this was really a touch-and-go exercise because you actually didn't know how to, you know, what to expect in that realm. How did you handle the management of that?
Well, we've used throughout the pandemic the principles of disaster management, of command and control, which we changed the entire structure of Netcare in order to deal with the pandemic. And we've also used the principles of occupational health and safety to ensure that we leave no stone unturned in protecting our workers against a highly contagious virus. And then we pivoted off that in terms of our bed occupancy. We're very fortunate that many of our systems in Netcare are digitized, and so we're able to monitor these very carefully and throughout the day and night from a central command structure here at head office in order to alter the number of beds available on any particular day, in fact, any hour of the day or night. And in the second wave, as we saw in KwaZulu-Natal, we almost reached the stage where we had no beds left in the province. We were able to obviously manage it better in the Gauteng because government had then introduced lockdown measures in early January. And I think in many ways that saved us going into a horrific second wave here in the Gauteng in early January.
As you say that, there's still some concern, and we're speaking to some experts as the days unfold, about the private sector's ability to vaccinate people quickly and effectively. We heard from one expert earlier on. What's your take on that as far as Netcare is concerned and the private sector in general?
Well, I don't think this is a private sector issue at all. In fact, we played a huge role in the vaccination of people. During the first phase, the Sisonke phase, J&J phase for healthcare workers, we did 65,000 vaccines across our hospital sites. Mill Park, for example, was a mega site doing about 3,000 vaccines a day. In fact, on the last Friday of the Sisonke trial, we did 3,700. Not only did we do 65,000, but we sent vaccinators and administrators and site managers to many other sites. And we'll continue to assist with phase 2. That's the public rollout. We've now made available sites at 30 of our Medicross family medical and dental centers. and also some of our hospital sites. But really, I would argue that it's behoven on every single South African, whether you're in the public or private sector, in corporate life or within an NGO or within a community, to ensure that we persuade everyone to get their vaccine. And this is the most critical factor facing South Africa. So I think that the private sector, in short, has come to the party through a Business for South Africa in a big way and in collaboration with our Department of Health.
Richard, just remind us, where are we with the vaccination of your healthcare workers at the moment? What numbers are we looking at?
We have completed 30,000 of our frontline workers. We have 44,000 in total on our campus. And that obviously includes doctors and their staff and allied health professionals, and obviously our contracted staff, which are cleaners, caterers, and security staff. And so we have about another 13 to 14,000 of these workers to vaccinate. We're hoping to achieve that on our sites within the next 2 to 3 weeks.
The most challenging part of a potential third wave would be what, as you sort out, as you strengthen your efficiencies at Netcare?
Well, I think the issue around a third wave is the severity. Is it going to be confined to a single province or not? We're certainly not seeing it in KwaZulu-Natal. We're not seeing it in the Eastern Cape. The numbers coming out of the Western Cape are very small. But we are seeing week on week for the past 3 weeks a rise here in the Gauteng. Now, in strict terms, from a definition point of view, we're not in the third wave because we haven't reached 30% of the positive cases on a 7-day average that we would have seen in the second wave. And in the second wave, we saw about 5,500 cases per day at the peak. We're now currently tracking at about 1,300 cases per day. But we believe we'll probably get to that third wave in the next 7 to 10 days. And it all depends on how severe that third wave is. We are coming into winter, and that's always a concern because it's very difficult to socially distance. People are indoors. There's poor ventilation. And we've seen this in Europe, that colder weather tends to congregate people closer together, and it's a huge risk factor. On the flip side of that, there is talk that there is a much greater herd immunity in our country than was previously indicated by the number of people who've had COVID virus infections. And so it depends on all of these factors that will determine the severity. But clearly, the numbers are the biggest concern. If it's at the level of the second wave, I believe we can cope. If it's higher than that, certainly at a provincial level, that will present problems.
All right, we're going to have to leave it there. Very insightful indeed. Netcare CEO Richard Friedland. And sorry, that's all from the money desk. I mean, 7 to 10 days, that's the